Hi everyone, I am Logan Florin and I'm going to be discussing with you today endometriosis. The learning objectives are to define the condition and its key symptoms, know the prevalence and social impacts, identify social work roles at the micro, meso, and macro levels, and to recognize the importance of advocacy and support systems. What is endometriosis? It is a chronic inflammatory disease where abnormal tissue, known as lesions, resembling the uterine lining, containing sensory nerve fibers, grow outside the uterus. It is characterized by an array of symptoms that make it difficult to function normally, most notably chronic pelvic pain. Endometriosis can cause infertility and complications during pregnancy. It also leads to mood disorders, most commonly depression. Surgery is required for a patient to get a definitive diagnosis. However, transvaginal sonograms and MRIs are used to help lead to a diagnosis. There are 3 available options for treatment, which are pain relievers like Tylenol, ibuprofen, or for more severe cases, prescription medication. Hormonal therapy is used to suppress the estrogen sensitive growth of lesions. And the third treatment option, also the most invasive, is surgery to remove the abnormal tissue. The World Health Organization approximates that globally endometriosis affects 190 million women and that it is one of the leading causes of infertility, with an estimated 25 to 50% of those diagnosed experiencing infertility. Mismer et al. Report on multiple studies showing that symptoms make it difficult to participate socially, causing individuals to withdraw into isolation. It affects work productivity and efficacy, disrupting academic and career growth and opportunity, as well as disrupts individuals' ability to build and foster intimate relationships, affecting the sexual well-being of both the individual and their partner. They also document a study of which found endometriosis patients pay $11,000 more annually in medical costs than those without the condition, as well as spend an average of 70 days a year bedridden. According to Velo et al., endometriosis accounts for substantial societal and economic strain, costing the U.S. over $20 billion each year in lost productivity and direct healthcare costs. Micro-level intervention for endometriosis will involve direct individualized support, including counseling and therapy, care coordination, and working with the family system to help clients manage chronic pain, navigate healthcare systems, and improve overall well-being. Individual counseling and therapy will be trauma-informed care and use a strengths-based approach to develop and implement an individualized plan with attainable goals such as processing and finding acceptance with the diagnosis, and learning skills for pain management and other related symptoms, including anxiety and depression. In care coordination, the social worker will be aiding the client in scheduling appointments, connecting them to specialists, and accessing insurance and financial resources. Intervention will include the family system, educating them on endometriosis and what it means for the client's physical, mental, and emotional well-being. Including the family also allows the social worker to assess family dynamics, evaluate their capacity to provide support, and incorporate these insights into the client's treatment plan. Due to endometriosis causing sufferers to become isolated and depressed, meso-level intervention will focus on strengthening group engagement and promoting organizational support. This includes peer support groups, interdisciplinary healthcare teams, and implementation of workplace wellness programs. At the macro level, social work interventions for chronic diseases such as endometriosis need to focus on systemic change. Beneficial macro interventions for endometriosis include public health campaigns to increase awareness, reduce stigma, and promote early diagnosis and treatment. Currently, there is no cure or preventative treatment for endometriosis. And so research and data advocacy is essential to promote funding in research. Workplace policy advocacy will urge policymakers to create flexible sick leave policies, menstrual or chronic illness accommodations, and to recognize chronic diseases as a disability. My biggest takeaway from this course is the importance of interdisciplinary teams in providing client-centered healthcare. I've come to better understand the many moving parts in a person's lived experience and how those factors are directly connected to their overall well-being. Interdisciplinary work involves not only healthcare providers, but professionals across all aspects of our social system. This course has highlighted for me the broad nature of social work and the many roles social workers hold. We have a place in every setting, helping to connect clients to the larger systems that impact their lives. Social work epitomizes the ethos of the whole being greater than the sum of its parts. Thank you for taking the time to watch this presentation. I hope you are ending this with more knowledge about endometriosis, and I look forward to watching and learning from your presentations.